spinal anesthesia, otherwise known as subarachnoid block. Before entering into spinal anesthesia, we will learn about the anatomy of spine. The spinal cord consists of 32 pairs of spinal nerves. Spinal cord ends at the level of lower border of L1. Dural sac ends at the level of lower border of S2. Dural sac below the level of L1 is filled with CSF, cerebrospinal fluid. Usually spinal anesthesia is given by making lumbar puncture. Lumbar puncture It is the procedure of passing long fine needle through an interspinous space in lumbar region below the level of L2 to reach the subarachnoid space of the dural sac. Then CSF can be drained or drugs may be deposited inside the sac. Lumbar puncture can be performed in any interspinous space between L2 and L4. When the patient is kept in right lateral position with well-flexed spinal column. Position. Right lateral position is the most common position used. Some people do the lumbar puncture when the patient is in sitting posture with the back bent forwards. During this position, the technician will be standing in front and allow the patient to bend forward by holding his shoulders gently and supporting his head by resting on his chest. Spinal needle. It is a long fine needle which is used to reach the subarachnoid space. Length commonly used needle is 9 cm. The shorter ones are for use in children. The needle passes through skin, subcutaneous tissue, supraspinous ligament, interspinous ligament, ligamentum flavum, 2 layers of dura mater under arachnoid mater, subarachnoid space, return of CSF. As soon as the subarachnoid injection is completed, the patient is brought back to supine position very gently without jerking movements. Any violent and jerky movements will cause turbulence, unsteady movement in CSF, and all to the level of anesthesia.